My name is Dr. Lynne Richardson, and I am the co-director of the Institute for Health Equity Research at Mount Sinai, where I'm also a professor of emergency medicine and a professor of population health science and policy. Well, that's a big question. The impacts of racism happen at various levels because, of course, racism happens at various levels. There's the experience of being personally discriminated against, whether that's racial slurs or hate crimes, or the experience of being followed in a store because you're under suspicion that you're going to steal because of the way you look. And all of those sorts of macro and micro aggressions really undermine your sense of self-confidence, your sense of self-esteem, your sense of safety. And it's like having repeated traumas on your mental and emotional well-being. And there's lots of evidence that racism of various kinds really has a destructive impact on mental health. There's a growing awareness of the importance of structural racism in that picture, and that's really the limited access to societal resources like housing and food and job security and healthcare, and the persistent inequities in the way that those resources are distributed across our society have an impact, again, on our mental health and well-being. It's those persistent negative messages that you are not valued, that you are not protected. And this is why we see huge disparities in conditions like depression. African Americans are much more likely to have more severe symptoms. They have a longer course of illness, and they experience greater levels of disability from depression compared to white patients. It's also why rates of youth suicide are exploding in the Black community, with something like a 73% increase over the last decade of suicide attempts amongst young people of color. And in terms of suicide death rates, the fastest growing segment are Black children between the ages of 5 and 12. And so the impacts of racism and the deleterious effects that it has on mental health, we're really seeing reflected in this epidemic of suicide amongst Black youth. So racism affects physical health in direct ways because, again, due to structural racism, you may be more likely to live in housing that is substandard, housing that has environmental toxins or irritants that directly impact your health. You're more likely to live in a neighborhood where there's higher levels of air pollution, where there are higher levels of violent crime. You are more likely to not get the health care that you need. And so you may have a higher burden of disease and more avoidable complications of illnesses like hypertension and diabetes and heart failure, asthma. And so these effects are cumulative, and they directly impact the physical health of communities that are experiencing the effects of structural racism. And there's also a connection between the mental health and the physical health. We know that the assaults on your mental health also affect your body. It affects your immune system and makes you more susceptible to disease. It affects your hormonal system. It results in problems with your adrenal regulation. And so the more we understand about how complex health disparities are of all the different things that create these differences in health between Blacks and other groups, the more we understand how racism is often a root cause of many of these effects. Well, I think it is important to not only talk about the the negative ways in which racism impacts Black people, but also to remember all of the strengths that have helped us to get to where we are today. I think that we have to pay attention to take care of ourselves and take care of each other, especially given the recent impact of the COVID pandemic. I think it's even more important that we lean on our strong social supports of families and friends. For many people, spirituality is a source of strength and comfort. And I think we have to try to directly address the inequities that are really leading to these negative impacts on our mental and physical health. I have a colleague who talks about spreading hope as a strategy to deal with what we are facing with really combating the effects of racism. And I love that image that we really have to spread hope and think about all the ways that we can improve our own individual and our collective emotional and physical well-being. Well, I think all of us have an obligation to advocate for anti-racist policies, and I think that happens at every level. There are societal issues, there are policies and processes in every institution that we belong to. There are things that we can do every place we are to try to understand how these structural inequities are really embedded in our society and to start to dismantle them. We need to do that where we work, where we go to school, where we worship. Really, in every context, we all need to be doing this anti racism work if we really want to make a difference and we really want to end uh, these long-lasting, persistent effect of racism on communities of color. There's a lot of discussion now about implicit bias, and one of the things that I think is not widely understood about implicit bias or unconscious bias is that while it may happen at a subconscious level on the part of the person who has the bias, it has a very explicit impact on the person who is the recipient of the bias. And so um, there's almost a sense that because it's unconscious and implicit and not intentional, that it's not harmful. But it's very harmful, and it really results in a lot of the microaggressions that do create repeated micro traumas that erode our physical and mental health. And so I think everybody has individual work to do on themselves to understand the extent to which they have internalized the biases that are really pervasive in our society, as well as to work at a higher level collectively on our organizations and institutions and really try to eliminate the structural racism that, again, is persistent and pervasive throughout our institutions.